The time I spend doing work with Health Alliance, and a lot of the work I do in the last 4 or 5 years has been with skilled care, looking at the admissions and sometimes the denials to those levels of care. And when I was getting ready to give this talk, I was thinking about what goes on, and not uncommonly do I get phone calls when I do a denial from the case manager, the nurse, the physician, the hospitalist, saying, what was I thinking when I denied this person? Because it all ends up with the same last line is, this person can't go home. They need to go to the nursing home. And so I thought if during this talk we could go through some of the things that are the regulatory requirements of what necessitates the coverage in a skilled facility, and what are your alternatives for people once they've discharged from the acute level of care for their care outside of the hospital situation. And when I was thinking about it, I remember my trip to Israel, and this is a view from the Mount of Olives looking across the Kidron Valley into Old Jerusalem. And this is the Temple Mount, the Dome of the Rock. It's really important to several different religions. They all see it as a very holy place, but they all see it from a different perspective. To the Muslims, it's the site where Muhammad went up to heaven. For the Jews, it's a place where the second temple was built. For Christians, it's where Jesus taught and walked in the temple and met with the people. So in the same fashion, when we're looking at these people being discharged from hospital, we're seeing their situation from a different perspective. The patient's family are looking at them and saying they need this level of care. The providers who are trying to get them out of the hospital are saying, look, they need some higher level of care than what they would get just at home. And we as a health plan are looking to say, what are the issues that would go ahead and allow them to be covered under skilled level of care? So we look at two things, custodial care and skilled care. Custodial level of care is really that type of thing where you're having some type of assistance for that person to get through the daily activities. They're trying to go ahead and get things done through their own home or in the nursing home, but they can't do it on their own. They need some level of assistance. It does not have to be from an individual who has any special training. It doesn't require anything. Let's see. It doesn't require any special supervision by people who have some sort of technical skills. It can be done by family members. It can be done by aides or people that come in and are hired. So it's really a level of care that doesn't require the expertise of some specialized training, but it is necessary for some of these people to have in order to be able to function and to improve in the post-acute care setting. Whereas skilled care is a lot more complex. It really needs to be done by somebody who's been trained. They need to have some qualifications. It has to be supervised by these people. And it's not just the average person that would typically be expected to be able to deliver these services. So these are the type of situations that we're looking at when we do our reviews for skilled versus custodial level of care. But that still leaves you in the position of what are your post-acute care options. So people can go home alone with some sort of non-skilled support. They could have family members, they could have aides coming in.